Common drugs in obstetrics. Oxytocin, a polypeptide hormone synthesized in supraoptic and paraventricular nuclei of hypothalamus and stored in posterior pituitary. The synthetic form is syntocinon, oxytocin. Mechanism of action of oxytocin. Oxytocin acts on both uterus and breast. In uterus, oxytocin has uterotonic action, causing physiological uterine contraction, that is, contraction of upper uterine segment, and relaxation of lower uterine segment. Oxytocin binds to G protein-coupled receptors in the myometrium, resulting in depolarization of muscle fibers and influx of calcium ions. Note: methergin differs from oxytocin that it causes tetanic contraction, that is, contraction of both upper and lower uterine segment without relaxation. In breast, oxytocin causes contraction of myoepithelial cells of mammary alveoli, resulting in milk ejection reflex. Routes of administration of oxytocin. Intravenous route is the most common route of administration and starts acting immediately. Intramuscular route, action start in 2 to 3 minutes. Oxytocin is also available in buccal tablets as desamino-oxytocin and in nasal sprays. Intranasal sprays are used in breast engorgement. Oxytocin is not used orally as it is degraded to inactive form when administered orally. 1 ampoule of oxytocin contains 5 units in 1 milliliter. Indications of oxytocin. Oxytocin is mainly used for induction and augmentation of labor, prevention and control of postpartum hemorrhage. For induction and augmentation of labor, oxytocin is administered as slow intravenous infusion of 2.5 units of oxytocin, diluted in 500 milliliters of ringolactate, and infusion is progressively titrated by 8 drops every 30 minutes, that is 2.5 milliunits, till effective uterine contractions are achieved. Oxytocin is used in active management of third stage of labor. 10 international units of oxytocin given, either intravenous or intramuscular route. For control of postpartum hemorrhage. Oxytocin 10 to 20 international units at 60 drops per minute. Note: active management of third stage of labor include 10 international units of oxytocin, controlled cord traction, for removal of placenta known as Brand-Andrews method, and uterine massage. These steps helps in preventing postpartum hemorrhage. Other uses of oxytocin includes breast engorgement, oxytocin given intranasal spray before feeding, and oxytocin challenge test. Note: oxytocin challenge test is done to determine uteroplacental adequacy in high-risk pregnancy. Due to increased risk associated with it, it is rarely performed now. Contraindications of oxytocin. Malpresentations, fetal distress, previous cesarean section due to increased risk of uterine rupture, and in grand multipara. Before use of oxytocin, malpresentations, cephalopelvic disproportion, placenta previa, and fetal distress should be ruled out. Adverse effects of oxytocin. Uterine hyperstimulation, that is production of strong uterine contractions which forces the expulsion of presenting part through incompletely dilated cervix, may cause uterine rupture, fetal hypoxia and fetal death. Other side effects includes water intoxication and hypotension.